out of ignorance. Where this is the case, we make information available in the language they understand to pull down the practice. So another impact of our social action is reduction in the practice, in the harmful practice. Reduction in the detrimental practice is another outcome of our social action. For instance, our community intervention on the practice of FGM. This practice was very rampant in some communities in Delta State. From our research, some communities were carrying out the practice on the ground. However, through our intervention, there was reduction in the practice as detrimental effects were well known, and the existing law on the practice was also made known to them in the language they understand. Attention, through our intervention, attention is drawn to the problem. In some cases, people are not aware about the fact that the problem under focus is problematic, thus they engage in the practice. But when their attention is drawn to the detrimental effect of the practice, they tend to stop it. For instance, an example of this is the practice of child hawking. Many people did not realize that child hawking was detrimental to children as it violates their rights until attention was drawn to it through social intervention. This resulted in the setting up of Edu Marshal in Delta State that took children off the street and increased school enrollment within the state. Another important outcome is GPI graduates, because social action is one criteria that every GPI must go through before they become GPI graduates and peer educators. When girls graduate from GPI, they become agents of change and impact their environment positively. They become peer educators, uprooting patriarchal practices from their immediate and secondary environment. We have countless graduates who are effecting positive changes in their environment. Prominent among them are Kel Osakwe and Comfort Ikpeni, who are not only agents of positive change, but have become role models for younger generations. What has worked for us so far utilizing this strategy? Our social intervention carried out by girls using peer-to-peer method of intervention has created more impact than the adult adult-to-peer method, as young people tend to listen more to their age mates than to those not within their age bracket. What has not worked for us? What did not work well for us or hasn't worked well for us so far? Most people tend to hold on to traditional beliefs and practices, even when these practices are harmful to women and girls. This can be very challenging. However, this challenging hurdle can be crossed with persistence and appropriate networking. What can be done? More organizations should use social action strategies to effect positive changes, especially around harmful, negative traditional practices, both old and contemporary. As more people use social action, the more results will be seen from this method, because collectively we can do more. Though we are doing much individually, we can do more collectively. Thank you very much.
Thank you very much, Hita, for that presentation on peer education and social action. Truly a big issue that has made gender equality difficult to attain is the fact that negative norms are very difficult to change. We are glad to note that peer-to-peer is a wonderful strategy for addressing such negative norms, that they are more effective than adults to youth or adults to children strategies. That is well noted, and you're called that more organizations come on board. I'm very certain that everyone participating in this session have noted that we could all add to our programming peer-to-peer interventions. People speak to people, people understand. So they know, we all know how to reach our peers, and we could be seen as more credible than that outsider that comes from elsewhere to talk to such peers. With that, we have come to the end of Comprehensive Sexuality Education as a strategy for bringing about empowerment of girls and the achievement of gender equality. We still have a presentation that is which is our last presentation later, that will be looking at the impact of GPI programming. What has been the impact of GPI programming? We were able to look at that through a research we conducted with the support of GATW. We'll get to that. Loretta will be presenting on that later. So before we go to the session, that will be looking at trafficking in girls, children on the move, irregular migration, we would give some space for contributions, questions, and answers. So I have looked at the chat box. I am not seeing questions there. You could put your questions in the chat box, or you could indicate by raising your hand if you have, if you want to use this space to share the work of your organization, or similar to what we are doing, or you have clarifications you seek. We have 10 minutes for that. Okay. I don't see any raised hand. And there are no questions. Okay. There's a question from Jane Kerr. She's asking, are most Nigerian girls able to attend school? Comfort. Are most Nigerian girls able to attend school? Comfort. Okay, I can't see Comfort there. Okay, Comfort, could you address that? Are most Nigerian girls able to attend school?
Okay, thank you very much for that question. Like I earlier had in my presentation, most of the adolescent reproductive health challenges that girls face actually keep some of them out of school, especially those of them who are survivors of child early and forced marriage, because the moment they are forced into marriage, the next thing is to start bearing. And of course, we know at that point, they are not physically developed to go through the process of pregnancy physically, psychologically, emotionally, and the rest. So most of them are actually out of school because of the challenges they face as a result of being a girl child, as a result of violence against girls and women, as a result of the reproductive health challenges that come their way. Though, like I said, the percentages varies in the geopolitical zones in Nigeria. In the northern side of the country, it is majority of the girls, in fact, 50% of girls are not able to attend school because of one of the issues I've mentioned or the other. But in other regions, the percentages are not as high as that. Thank you very much.
Thank you very much, Comfort. Yes, if we go by the population of girls in the country and look at the population that is out of school, it's difficult to say that most girls are able to be in school. And whether or not our government, there's a question by Carrie Blankenship asking, is your government working to get equality for girls' education? The rest is yes, that the government is making efforts to get equality for girls' education, but we are still very far from achieving that because of the challenges that Comfort enumerated earlier. Simple things like having toilets in school may not impact boys the way it impacts girls. We still have schools that do not have sufficient toilet facilities. There are states where tuition is free, where books, schooling materials are free, but that is not countrywide. So both state governments, local governments, federal governments are making attempts, but the gap is still a very wide gap. We do hope that we'll get there. And the current situation of insecurity is not helping, because again and again, we have situations of girls being abducted from school in an effort to dissuade children from going to school, because the terrorists have also started abducting boys as well. But more girls have been abducted during this period. That is not an encouraging factor for sending girls or even sending children to school. Thank you for those questions. We shall be, as there are no other questions in the chat box, we shall be going on now to the second part of our presentation. And this is looking at children on the move, irregular migration, and human trafficking. This event is co-sponsored by Girls Fire Initiative and the Save the Child Initiative, an NGO with centers in Sokoto State and the Federal Capital Territory. GPI and STCI are the coordinators of the West African Network for the Protection of Children in Nigeria. It's my privilege and honor to invite Abdul Ganiyu Abubakar, the Nigeria South Coordinator of the Network for the Protection of Children, the Chief Executive Officer of Save the Child Initiative, the National President of the Network Against Child Trafficking and Labor in Nigeria, who will be giving the presentation on WAN as a mechanism. Abdul Ganiyu, please.
Thank you very much, Momsi Grace Osakwe, my mentor, my guide, my coach. Good evening, distinguished ladies and gentlemen. Good evening, advocates. I'll be talking very briefly about the WAN mechanism, that is the West African Network for the Protection of Children, which is a sub-regional mechanism for the protection of vulnerable children and young migrants moving across borders in West Africa. It is a mechanism that has been implemented over the last 20 years in the West African sub-region, and as a result of the common standard of operation that these organizations under this mechanism have used in the implementation of this mechanism, over 10,000 vulnerable children and young migrants were identified, protected, reintegrated, and professionally supported within the West African space in the last 10 years. Why the West African Network for the Protection of Children? In the year 2000, 2 children from Guinea-Conakry were discovered dead in the wings of an aircraft that is bound for Belgium. Now, in the pocket of these 2 children was a short piece of paper where they have written that they are leaving their homes in Guinea-Conakry. They are leaving their family because of hardship, because of poverty, and they are going into the world in search of greener pasture. Now, having read this letter and the news headlines surrounding the circumstances that led to the death of these 2 children from Guinea-Bissau, all of them below the age of 10 in 2000. 3 countries of West Africa, Guinea-Bissau, Senegal, and Mali, decided to come together. Of course, these 3 countries also have challenges of children on the move, who are moving across borders and within cities of their countries. So they came together to pilot an intervention that will help amplify the voices of these late children, and of course, call the attention of both state and non-state actors to the plight of vulnerable children who are moving across borders, who are on the streets, either moving on their own, in company of other children, or in company of adults. This is how the West African Network for the Protection of Children started. The International Social Service, ISS Switzerland, took up the challenge. They got interested in this idea, and then, of course, offered to finance, to support the piloting of this idea. After 12 months, these 3 countries met in Mali, where they discussed and reflected on the journey so far. And it was discovered that in just 12 months, a lot of children have been identified, have been supported, have been protected and reintegrated back into their families and communities across these 3 countries. And of course, other development partners were also excited by the results achieved in just 1 year. So the International Social Service, with the support of the European Union and other development partners, decided to scale up this intervention. And they begin to imagine an ECOWAS sub-region, where all the countries of the sub-region will have a common mechanism of collaboration that will enable countries identify and protect their children. So they put in place a strategy to ensure that at the end of every country,
imagine being with someone that you can't afford for the guy
at the end of every year, acted into this very important mechanism. So that is how it continued from 2000 up to 2008, when Nigeria was to be integrated. And there was an assessment visit to Nigeria from Nigeria North, Sokoto State in particular. The International Social Service, in collaboration with the West African Network for the Protection of Children in Niger Republic, which was just integrated in 2008 before Nigeria, came to Sokoto for an assessment to understand the situation of vulnerable children on the move in Sokoto State. And of course, it was discovered that there are a lot of children, not just of Nigerian origin, but also of other countries of West Africa, moving across all the porous borders, markets, motor parks, food restaurants, and even in April 2011, Nigeria was integrated into the family of West Africa, and we were mandated to implement a pilot project for 6 months, April to October 2011. Within these 6 months, we succeeded in identifying and returning 386 children between Nigeria and the Republic. And most of these children, over 80%, is in November 2011, it was concluded that it is important to have a coordination in southern Nigeria. Where in southern Nigeria, of course, where we have most of these children and young girls coming from. So we had 3 assessment visits to Benin City, and eventually Girls Power Initiative, after a very rigorous assessment, was appointed as the coordination structure for the West African Network for the Protection of Children in Nigerian South. And Nigeria became very unique. Nigeria became the only country with 2 coordinations because of the size, the dynamics, and then of course, the peculiarity of the situation of vulnerable children and young migrants in Nigeria. Nigeria was the 11th country of ECOWAS to be integrated into the WAN mechanism in 2011. And of course, between 2011 to 2014, all the 15 countries of ECOWAS have been successfully integrated into the WAN mechanism. Now, while this integration process was going on, the actors of the West African Network for the Protection of Children also decided to begin to develop a common standard. Then we call it the WAN standard, West African Network for the Protection of Children standard. It is like a manual that guides our operations by standard, by steps, through identification, listening to the personal situation of the child, providing counseling services, and all forms of care up to the reintegration of the child, as well as professional support, and then monitoring and evaluation of the professional projects of the child. We do not only identify and return children, but we also conduct a comprehensive assessment of the family situation, of the community situation, in order to be able to understand what are those situations that led the child to the street, and then of course address those situations at the family level as well as the community level, depending on the situation. Now, while doing all this, WAN was also working with the support of the International Social Service and with funding from the European Union, the Swedish Agency for Development and Cooperation, SDC, and the ECOWAS Commission to also integrate different state and non-state actors into this mechanism. Every year we have 2 meetings. One usually in June, which is a meeting of the coordinators. We call it the regional meeting of WAN national coordinators. And of course, because we are also working with state actors to ensure ownership and sustainability at the end, we also have a steering committee meeting, usually in November or December, which brings together the directors of child protection from all the countries of ECOWAS. That makes up the steering committee and, of course, the highest decision-making body of WAN. While doing all this, we also make sure that the ECOWAS Commission is carried along as the sub-regional body, of course, that ensures interface between states, member states of the sub-region. And in 2015, the WAN mechanism was capitalized in Abuja, Nigeria. The 3 days event following the capitalization of WAN was held at the ECOWAS Commission in Abuja. It is during this meeting that the ECOWAS Commission adopted the WAN standard, as it is called then, to become the ECOWAS support procedure for the identification, the integration, and support of vulnerable children and young migrants moving across borders in West Africa. And that instrument was adopted by ECOWAS Commission as a child protection instrument in the West African sub-region. As at 2015, when the WAN mechanism was capitalized, over 8,000 children were identified and duly supported, not just reintegrated and supported, but also monitored for a minimum of 2 years using the West African sub-region. In 2015, the WAN mechanism was joined as the most solid and viable
a new one just yesterday, so they're supposed to put the little bag for 3 days.
Distinguished ladies and gentlemen, this is the journey of the West African Network for the Protection of Children, a child protection mechanism that has been found to be very effective in the identification and protection of vulnerable children in the West African sub-region. This mechanism is unique in so many ways, in the sense that within a short period of time, it brought together all the 15 countries of ECOWAS under one umbrella, under one family as a mechanism, and of course, utilizing a common standard, which is the WAN standard that was eventually adopted by the ECOWAS Commission as a child protection instrument, as the guide, as the manual of operation, irrespective of the languages, of the language differences in the African sub. We have 3 major languages: English, French, and Portuguese. But despite all these differences, we're able to operate, we're able to exchange children, we're able to receive, protect, and reintegrate children from all the 15 countries of the sub-region. From the GPI presentation, you will understand why, out of all the organizations working in Southern Nigeria, and Benin City in particular, Guest Power was appointed after a very rigorous serve as the coordination structure for WAN Nigeria in Southern Nigeria. Just like Save the Child Initiative was also appointed after a very rigorous process to coordinate WAN mechanism in Northern Nigeria. Beyond West Africa, this mechanism has also gained acceptance globally. In 2014, Guest Power Initiative and Save the Child Initiative also hosted a side event at the second session of the Conference of Parties to the United Nations Convention Against Transnational Organized Crime, where we made a presentation on the WAN mechanism of cooperation among civil society and state actors in the West African sub-region using a common standard. That presentation drew the attention of so many stakeholders, particularly from Europe and other continents, because of uniformity of the standard that we have in achieving the results we have achieved as at 2014, despite the language differences. Of course, this mechanism is not without challenges, despite all the successes deliberated upon. Funding remains a major challenge. After 2015, which served as the capitalization year for the WAN mechanism, of course, we and the other partners had to begin to look elsewhere for sustainability. We have to begin to think outside the box. Of course, we are already thinking ownership and sustainability of this. by not just the coordinations and the countries of sub-region, but also including the ECOWAS Commission. So up till this moment, 2011, coordinations across West Africa are still collaborating, identifying, protecting, and integrating children, providing professional support in different axes, different areas to children who are mostly vulnerable and moving across borders. Sustainability, ownership and sustainability, particularly on the side of governments of West African states, have been a major challenge. Once again, ladies and gentlemen, this has been the journey of the West African Network for the Protection of Children, the mechanism that has been adjudged to be one of the best in not just the West African sub-region, but the African continent as a whole. Thank you so much for listening.
Muted. I'm sorry I was muted. I thank Abdulganiyu Abubakar for that journey through several years of work that covers the whole of the West African region and work that has benefited both boys and girls and children on the move, both accompanied and unaccompanied, who found themselves in vulnerable situations. It's been very profitable work, as can be seen in the ECOWAS Commission adopting the standards we use as the standards for use in the entire region by governments, state and non-state actors. I will now invite Rabiu Bello Gandhi, a staff of Save the Child Initiative and the case manager for WAN Nigeria North, to add a few things that would help us know STCI more, as well as how the work of WAN has impacted girls on the move, and girls who are vulnerable to trafficking. Rabiu, please.
Thank you very much, Nancy, for the wonderful work we are doing. We really we miss you. We only see you on the screen. So thank you very much for the one that thank for the GPI family. I'm like Abdulgani, we made a presentation on the WAN mechanism across the West Africa. And also within the mechanism, he talked about the steps that we do in giving service to the children on the move. Like we do, when we identify also, we look at the needs of the children. We provide emergency needs for the children. When you identify, you need to also identify their needs and also provide them with the necessary support that they need at that time. And then when you do that, then you also study their situation. What are the situations they're into? Where are they coming from? Where are they going? What made them to leave? And why are they going where they want to go? And then when you establish that, then you're able to then have some information that you use in contacting the family. That's what we call family tracing and assessment. Then when you trace the family, we do it through the mechanism, the network. If a child from Niger and was identified in Cote d'Ivoire, for example, the mechanism or the network member in Cote d'Ivoire will do this. When you assess this, when you provide the emergency and also you study the personal situation of the child, then the information you get, you use it to communicate to the family in Niger. The network member in Niger will get the information through the mechanism and also do family tracing. Then when they trace the family, you do also the assessment. Assess the family, what are the causes? what are the root causes that made that child to leave the household or the family. Then also, if that house is conducive for the child to come back, then you also prefer for the child to move from the country that you identified, then country of origin. And also, if that house is not conducive for that child to come back, then you think of the alternative placement. Where will you place the child? Then you start giving a kind of intervention to the family to make sure that that house is conducive. Then after doing that, then you also think of social and also professional integration, because you need to support that child professionally to stand on his own. When you bring him back to the household or to the family without doing anything, he may go back to where he's coming from. So you also do that to make sure that that child is supported professionally to stand on his own, to be able to provide for himself and the family. Then you do a kind of support him. If the age of that child is favorable for him to go back to school, then you enroll him in school and make sure that you support him and keep him monitoring. If not, also you provide a professional training like trade or any other skill acquisition that you do to support the child to stand on his own. And then in doing that also, you do follow up. While you are giving your services, you are also following the impact of that service. Is the service making change into the child, into the family? What are the changes? Then what do you need to do? And what are the challenges and also steps you need to take to make sure that that child stand and also you bring him out of the situation that he's into. And then also you keep on supporting that child. Then also you think of what can you do in that child family or the community to prevent further the occurrence of the moving of the children from that community. Because sometimes it is not only the family, maybe the factor that made that child to leave, it is within the community. So you need also to address the cause. What are the things that make that child to leave the community and also go out of his community and find himself on the move? So we do all those things across the network. And all this we are doing it in partnership with the member organization across the West African countries. And we also document all these steps. In documenting these steps, we have sheets. We have 8 sheets that we normally fill, right from the identification to the emergency care, to the study of the personal situation, and also the family tracing, family assessment, alternative placement, social and professional integration, follow-up and monitoring, and also family and all community support. And in doing that, we document, we have a database that is called case data. All this information are stored in the case data where all the countries have access to the services given to beneficiary. Like I said, the child that was identified in Cote d'Ivoire going to Niger, all the services given to him by the Cote d'Ivoire partners is documented. And also the Niger counterpart will show the services and will also continue from where the Cote d'Ivoire stopped. So all the services are documented by using case data, and reports are being shared among the member organizations, lessons learned, and also we also use the lessons learned to improve upon the services provided to these children. And in doing that, it impacted a lot into the children. Like we also support the emerging children that we have in northern Nigeria, and Save the Child initiative doing that to integrate a lot of children between Nigeria and Niger, between Nigeria and Mali, where we receive also a lot of children who have been who travel from Nigeria to Niger for the sake of knowledge, and we bring them back using the mechanism and also integrate them into their society, and they are supported economically and also educationally to stand on his own. Some of them now are doing well. We have one of them that right now he has joined police force and is a police officer through that mechanism in Sokoto State. So in a nutshell, these are also a kind of way we provide the case management in the WAN mechanism. Thank you very much. Hello? Hello?
Thank you so much, Rabiu,
Yeah,
for that
welcome.
presentation.
Yeah.
Bringing it closer home, letting us know the steps that we utilize from identification to reunification, rehabilitation, community support, and so on. The standards, I have uploaded the standard to the chat box for everyone interested to be able to access the document. It's a wonderful document. We have it in English and in French. I will upload the French version shortly. The one uploaded so far is the English version. Having heard from Rabiu and Abdul Ganiu on our work on children on the move, both accompanied and unaccompanied, we'll be going now to community intervention as a strategy for reducing vulnerability of girls to human trafficking. To make that presentation is yet another coordinator of Girls Power Initiative, May Ekido, who coordinates the Edo State Center. May has a master's in education curriculum studies from the University of Benin, but she left the teaching profession in 2004 to work in Girls Power Initiative, where she rose to become the coordinator of the Edo State Center in January 2021. She has been an activist on women's rights since 1989 and has executed interventions on gender issues, girl-child education, women empowerment, and various aspects of human rights. Mabel, you are very welcome to speak on community intervention.
Thank you very much, Momsi. Can everyone hear me, please?
Clearly.
Momsi, can you hear me? Okay. Good morning, good afternoon, and good evening. I'm glad you are here in our session. I want to talk briefly on community intervention as a strategy to reduce human trafficking of women and girls in Nigeria. Permit me to share my screen. Trafficking in persons. Okay. Trafficking in persons, especially the trafficking of women and children, is actually a global phenomenon that has impacted disproportionately on countries, with a major factor explaining this being the different economic levels in these various countries. That was by BC Olateru Olagbegi, Path to Women's Development, page 15. Page 55. What are the facts on human trafficking? The fact remains that the purpose of trafficking in humans is just for exploitation. And boys, girls, youths, even women are all vulnerable and prone to being trafficked. Traffickers are not strangers. They are known to the victims. And victims may unknowingly cooperate with traffickers. Traffickers use various tricks to entice their victims. They tell the victims that there are good jobs in European countries and other countries of destination, and they try as much as possible to deceive their victims. Traffickers have now moved to villages, avoiding the city centers, and the method they use in recruiting is still the same, but now they still pass through the victims' parents and also agents. traffickers' tricks is age long and is still on. People who have been trafficked, many victims, they end up being potential traffickers themselves because they have found out that there is some gains in trafficking, which of course is not good at all for others. Edo State has become a source of trafficking. Apart from being a source, it's also a transit place and also a destination place. We are looking at Nigeria entirely, but Edo State, out of the 36 states, have become a hotspot for traffickers and trafficking activities. Victims therefore claim that they are from Edo State, even though they are from neighboring states. And people come into Nigeria for these same purposes. We have people coming in from neighboring countries into Nigeria for organized crimes, for prostitution, for street begging, and for domestic purposes. The proceeds from trafficking is spread all over our streets, where you see secondhand goods, you see goods being shipped from abroad, cars and various things lining our streets. The categories of victims formerly used to be children and girls, but now even married women, they are not left out because with or without the consent of their spouse, some married women are also being trafficked. They fall victims. We also have children below the ages of 8 that are also being trafficked. And we have internal trafficking. Some people may not know that there is internal trafficking, but there is internal trafficking. We have internal trafficking in Nigeria because we have different states, and some people come from the north and middle belts to other parts of Nigeria. The purpose for which they are trafficked depends on where they are going to and where they are from. If they are coming from the north and middle belts to other parts of the country or other parts of the states, they are being trafficked for the purposes of child labor, forced marriages, street begging, and domestic work. But if it is from other parts to the eastern part of Nigeria, it's for the purposes of baby factories, whereby teenagers are paid off after delivering their babies. The babies are sold off. Then if it is from the south to other parts of Nigeria, it is for the purposes of domestic work. External trafficking, on the other hand, has to do with men and boys who are being trafficked out of the country. And when they go to their destination countries, they are used for purposes of hard labor in farms, prostitution, organized crime, criminal activities, and organ sales. While the women and girls are exploited, they are turned into prostitutes, sale of embryos, sale of ovum, forced marriages are what they are used to for. Who are the actors? The actors are diverse. We have parents, we have traffickers, we have agents, we have pairs of the girl who is to be trafficked, because their pairs can easily deceive them that they have aunties abroad who can assist them and they consent. Why does this problem persist in Nigeria? It's persisting because there's a lot of poverty. There are so many people that can hardly have a square meal in a day, 3 square meals in a day. There is greed, there's unemployment, the poor value system that we experience on a daily basis in our country, culture that silences children's voice and rights. Children don't have voice, they don't have rights, even though we have the Child Rights Act, but they hardly stick to it. Culture that recognizes children as breadwinners, gender issue, need to migrate, and problem with getting visa the right way. When people are frustrated, they are not able to get visa because they want to migrate rightly, what they do is to turn to traffickers. And out of desperation, they can easily be exploited. Government not replicating NGOs' best practices. NGOs are doing a lot of work, but we also need the government to assist in replicating NGOs' best practices. Community intervention to stem trafficking in women and girls. What are our various interventions? This includes various advocacy visits to community leaders, gatekeepers, market union leaders, opinion leaders, and other stakeholders. We engage them. When we get to the communities, we engage all these community leaders and let them know about human trafficking. In trying to prevent it, we have to have their say. We have produced a lot of posters, leaflets, stickers, and information, education, and communication materials for us to use in communities, because many people in the community, they still do not believe that there are no wonderful jobs abroad. What they believe is that as far as A has made it, they too can make it. So we send them posters, leaflets, just to educate them. Then we also have dialogue sessions with parents and parental pressure on their children that are being trafficked. The parents, when we speak to them, they tell us what their problems is in their community, and we try to find solutions to such problems. We have held so many town hall meetings with parents, community leaders, and traders, even artisans, men and women, is part of our strategy in addressing the issues of human trafficking, because it assists us to provide customized solutions for each community that we visit. We also have town hall meetings with transporters, because we discovered that transporters can play a major role in assisting in the prevention of human trafficking, as transporters are able to recognize who the traffickers are, and we're able to be able to blow the whistle. Other campaigns that we have done, we carry out market campaigns, because we discovered that most parents, they have places in the marketplace. So we visit them in their places of businesses and try to educate them that they should not allow traffickers to traffic their children for any reason. We also visit motor parks and also educate them on what to do when they see any person that they suspect is a trafficker. We carry out school-based activities too, awareness-raising activities, because GPI initiative is mostly into prevention. So we carry out awareness to inform the school children and to educate and enlighten them on what to expect and how to identify traffickers, resist traffickers, and where to go to when they need help. We also train peer educators who on their own carry out youth initiative in various schools, and also peer educators activities in their schools to talk to their peers. We use social media. If you go to our Facebook page, GPI initiative in it, you see our Facebook page, you see so many stories there on this issue of human trafficking. These testimonies are ways of reaching out to the unreached. Then we have a weekly slot on radio and television where discussion segment is being carried out on various topics on personal empowerment skills. We educate the general public on how to prevent human trafficking and where to report cases of human trafficking too. We provide scholarship for vulnerable girls, because we discovered that because so many of them are poor, they drop out of school. Like my colleague had earlier said, why students are not in school in so many places. So we assist them with scholarship, improve the livelihoods of their parents and caregivers, so that they will be able to retain their children in school with whatever economic means we give to them. We support victims that have been trafficked, though they don't like being called victims, or survivors that have been trafficked, with socioeconomic support. Then we trace their families and reintegrate them, just like Abu and Rabiu have said in our WAN project. We also have a similar thing like that in the anti-human trafficking projects. We also provide business education and mentorship program for victims, so that they will be able to set up their businesses and avoid being re-trafficked, because there are cases of people who have been trafficked, who have returned being re-trafficked. Our scorecard for the past 3 years, in working with the EU, ECPA France, and ECPA Luxembourg funded projects in Edo State, just Edo State alone. In the past 3 years, we've been able to reach out to 9,408 students and 4,403 teachers with information on human trafficking. We have interacted with 555 community leaders through town hall meetings on issues of human trafficking. We have sensitized 1,010 traders and buyers on prevention of human trafficking during our market campaigns. We have trained 2,359 peer educators versed in anti-human trafficking issues, who on their own have reached out to 41,426 pairs with same information. We have held community dialogue on parental pressure with 918 parents in 48 communities. We also reached 2,215,591 men and women, the general populace, with messages on anti-human trafficking through our Facebook campaign, which is on right now, our radio programs, our television programs, and various print media. We produced 10 billboards with anti-human trafficking messages. We have produced 4,000 posters, 200 t-shirts, 2,000 badges, 2,000 flyers, and other IEC materials carrying anti-human trafficking messages. We've collaborated with the various stakeholders and network on prevention of human trafficking. These are some of our pictures of activities that we have carried out. These are activities in the market. These are activities with our peer educators. These are activities on the international conferences. This is just the first virtual CSW that we are attending, but we've been attending CSW since 2009. We've been attending CSW. So these are our schools-based activities. And we have our town hall meetings and dialogues with community leaders, influencers, and parents. These are dialogue sessions. And these are our roadwork on how to stop human trafficking. We collaborate with NAPTIP and other organizations, to even government parastatals, to stop human trafficking. Thank you very much for listening. I think because of lack of time, I have to stop here. But if there are questions, I'm available to answer them. Thank you.
In a physical meeting, would have given you some clap. Times have really changed. Looking at those your pictures, we saw some without face mask, and we saw some with face mask.
Yes.
We have stories to tell about COVID-19 and hopefully post-COVID-19. I want to thank you, May, for that wonderful presentation on the different communities and environments that GPI anti-trafficking work is executed in, and the different strategies that are designed depending on the particular community that is to be interacted with. Truly, there is need for action everywhere for human trafficking to reduce, and for girls to become less vulnerable to human trafficking. Yes, boys are trafficked, but the girls still form the majority, and the avenues from which it happens span from the home to their schools, to after-school events, everywhere, to the media. The traffickers have become very, very strong at getting into the different sectors where girls are represented in an effort to recruit. We have even had situations where they tried to recruit from our Facebook page, where we were running a campaign against trafficking. We found posts there by traffickers trying to lure girls. So thank you, May, for that presentation. Our last presentation is going to be looking at the impact of GPI work on beneficiaries, but we are centering our presentation on the impact of our comprehensive sexuality education work on GPI girls and graduates. These days, we talk about monitoring, statistics. Well, do you know you are making a difference? It's difficult to quote figures, but we are going to use voices of beneficiaries to show you the difference that GPI has made in the lives of girls over the years. This assessment or research was done with support from the Global Alliance Against Trafficking in Women, GATW, which supported us to have a reflection on our work in the last 26 years. To make this presentation is Loretta Enofi-Laurel, the Program Officer for Girls Power Initiative Abuja Center. GPI has a center in the Federal Capital Territory, Abuja, and beyond the liaison officer, we have a program officer, and that is Loretta. Loretta, over to you.
Thank you very much, Momsi, and good morning, good afternoon, good evening, everyone. It's nice to have everyone join us today. So I'll be sharing my screen with us. Okay, I'm going to be presenting on Comprehensive Sexuality Education works, GPI's evidence from the Global Alliance Against Trafficking Women supported reflection process. Okay. So the reflection process took place for 7 months during the lockdown period in the middle of COVID. And it was an opportunity for we to say, fine, we've been doing comprehensive sexuality education since 1994. Let's reflect on this process. What are the feedbacks? What are our responses? Here is a statement from a 19-year-old GPI girl who says, I did not expect anything from GPI. I just went there. And I was like, God, I wonder what they do. Well, when I got there, they were wonderful. They taught me how to be open, very open, bold. Naturally, I like talking about women, but I don't know how I'll go out and speak. That shyness was in me. But now, if you want me to tell anything, tell me, and I'm going to stand for it. Communication skills then was zero, but now I can talk to anybody, anywhere I want to. So I thank GPI for that. That was from a 19-year-old GPI girl. So the reflection process captured girls from both who are graduates of GPI, girls in current GPI programs, as well as our stakeholders. And if you know this statement, says the human voice is the most perfect instrument of all. And that's what GPI, through her mission, has been doing and is currently doing in working with the lives of girls, building these voices to challenge status quo, building voices to become visible actors to drive social change. So brief on GPI, the GPI Safe Space 3 years adolescent CSE program, which has gender and human rights based as cross-cutting issues, was structured by the pioneering Girls of 1994, which was made up of GPI co-founders, girls and daughters and their friends. So Bene Madnagu and Grace Osakui's daughters and their friends were all a part of the beginning process of GPI's work.
Hello, Loretta.
Oh, sorry, I didn't know I got muted there. Can you see the screen?
Clearly.
Okay, I think I'm having some technological challenges here. The slides are not, okay. So right now our question is 26 years down the line, has the gender and human rights-based CSC on adolescent girls and young women been effective? How have they been effective? So the reflection process is going to give us an insight on that. The objective of the reflection process was to capture an honest feedback from girls and beneficiaries, as well as stakeholders who have participated in GPI's program. And the process involved qualitative and quantitative research methods, which were done electronically to capture these voices. The process, it was staff-led. We had past and present beneficiaries that were guided by the GPI theory of change. So the methodology that was used for this, we had population sample, which was made up of volunteers from the GPI levels of influence, as I had mentioned earlier. The individual involved the GPI girls themselves and the graduates. Then at the social network level, it involves parents and family members. This network level is there to strengthen positive relationships among girls and immediate social relations. Then at the community level, we have the teachers at the GPI outreach schools that have been explained to us and community members. At the institutional level, it involved policymakers who GPI works with to focus on social changes through activities and advocacy that would impact systematic practices and norms that is going to bring about the girls and having the tool that we use. The tools that we use, we had qualitative research methods that involve the electronic FG sessions for direct beneficiaries, which involve direct beneficiaries here implies the GPI girls and the graduates. There we had 10 sessions for electric of the FGD sessions for the graduates and 2 sessions for the GPI girls. So in total, we had 22 GPI girls participate in the focus group discussion, while for the graduates, we had 69 of them in 10 sessions. For the quantitative research methods, which was done through questionnaires and questionnaires using electronic surveys for indirect beneficiaries, which comprised of the parents of the girls, the teachers who were involved in outreach schools, the policymakers. Then fiscal administration of questionnaires were done to community members whom the girls had interaction with. The community members were those who lived around the centers, as well as the homes of the girls, whom the girls have direct interface with, and those people knew these girls specifically were GPI girls. So for our direct beneficiaries, there is the GA, we call that the GPI Graduate Alumni Association. We had electronic surveys for them. So in total of these, for the GA members, we had 195 of them. For parents, caregivers, or family members, we had 146. Policymakers, we had 24. Teachers, 21. And community members, 46. So in all of this, we're trying to develop reflections on the following themes, which were part of GPI strategy plan on, okay, for the girls, strategic communication was driven towards having increased knowledge to drive behavior change on issues of sexuality, SRHR, gender and human rights, and also having access to GPI support services. So different indicators were raised for that as shown on the screen. So I'm going to be driving straight on the girls' report. For Esther, who is a Calabar GPI girl, 13 years old, 2018 set, that means she's a level 2 girl, says, my knowledge on sexuality and reproductive health have improved by over 100% because I went broader than school studies. And as explained by other presenters, the GPI sexuality curriculum is comprehensive, is highly detailed. And the scope of the girls from 10 years old to 21 years participate in the focus group discussion, comprising from those from level 1, level 2, and level 3, with those from level 3 being the lowest among the number of girls sampled. And most of them were secondary school students and undergraduates. And when we asked, why did you join GPI? Who brought you? Majority had no reason for joining. We had some who just replied, oh, then as also at the point of joining GPI, there were no expectations, was only attend because someone had told them about it from their parents, from their family members, and most times insistence of family members. The reflection showed that majority of the girls that came to join the program were brought in by their peers. So 13 years old, level 2 girl who said, I heard about GPI from my neighbor, who is a GPI graduate. And my mom also heard about it from radio and all the empowerment programs GPI does. And GPI was not so far from my house. Directions from my neighbor. But the first time I went to them, they were closed for registration. So I had to go back the next year. Going next year just shows that GPI had become a level of importance that despite the weekend be a time for relaxation, to have fun, or to miss, wanted this source of information, this avenue where they could learn and build their. So in interaction with the girls, we asked them, fine, you are all girls, adolescent girls, what problems do you say you actually face? Majority of them responded at the moment they were not experiencing any problems, and they reported that to being because they were GPI girls, as they have helped in overcoming them. Though some mentioned some challenges, though it wasn't personal, but it was from parents' misconception of friendship with the opposite sex. However, they highlighted challenges faced by their peers, which involved for both sexes and peer pressure, lack of personal life skills, lack of information. As said by one of the girls, said 13 years old at a very young age, said, I'm facing any challenges as a girl. Some of my peers face inferiority complex. And using the information I got from GPI, I was able to speak to them. So at 13 years old, you can see social agents already coming up, not just gaining knowledge, but using the knowledge to impact others as a peer educator and to drive change. So, and we went further and asking, how can I help out in this? And there were series of comments by the girls, and some here, I'll take that of avoiding incidents of rape, who is a 21 years old Calabar GPI girl, 500 level agricultural student in the university. The situation of rape, I've been able to escape rape about twice through the teachings from GPI. I've been able to become assertive in rejecting sexual offers and making the right decisions by considering the pros and cons. My public speaking skills have really helped me. So these are just some examples that has been shown that GPI's Comprehensive Sexuality Education model works. Then we went further to have interactions with the graduates. The graduate, we had those from 16 years to 40 years, who amongst them, we have those who have achieved their master's degrees, while those who are still in secondary schools. And this was spread, the graduates were spread across the different centers and different sets of graduation. And their responses in their early stage and quest for knowledge as when they were girls are still similar to the current girls in the centers, which just shows that adolescent issues, despite the difference in age, in time, still remains. So we have one, there's why, and she was like, Pearl and I were in the same class in SS1, and she has happened to be my friend. She kept talking to me about GPI, and I thought it was a club or something like that. One day, I decided to go so that I can prove to her that that is not a place I want to be, and then get her off my back. I got there and found that my opinion was sought on issues and my views were respected. That's a pioneer GPI graduate from 1997. So in trying to give a report on from a quantitative survey from graduates, and we assess their impact, the impact of GPI program on their current everyday activity from graduation, be it from 1997 for those who just graduated in 2019, and we had nothing less than good. We had most.
Hello, Loretta, very sorry. Your time is up.
Okay. Oh, okay, I got carried away, sorry. Okay, that's just one last slide, please. Is this sustainability of GPI's impacts on them, which they all most of responded to 5%. How impactful has the program been in their career choices and development, of which most of them, so say two GPI program that in the development sectors, looking out social customers. And being a feminist institution is also good to those who have passed through GPI program affirm say that yes, feminists. And thank you very much.
Thank you very much, Loretta. I know you had a lot to say.
Okay.
No, I know you had a lot to say, but that will be for another time. We have just 4 minutes left for our session, and we had said we'll take questions at the end of the session. On the chat box, we see just 2 questions from Mayumi, and we see that Catherine's hand is up. So we'll quickly take the 2 questions and get back to Mayumi. Comfort, are you taking Mayumi's first question on boys? You do that. Let me take her second question first while you get ready for that. You wanted to know about our experience in terms of reactions from traffickers doing anti-trafficking work endangers NGOs. We agree with you, and usually we go with the police when we have any rallies. We involve security agencies, the police, the local security in whatever location we are having those events. And then for our offices, we also do our best to see that you have the entrance to the office is has security personnel, unlike previously where you can just walk into a GPI office. Now you have to go through a gate to be able to go into the office. Then we do our best to be friendly with the environment, because the neighborhood, the people in the neighborhood are our greatest assets and supporters. And when it comes to security, they also do their best to keep us informed if there are ongoings that are suspicious. So yes, it is risky, but we have been able to manage it. We also thank God for that. Comfort, there was a question by Mayumi on boys.
Sound is still.
Okay.
Oh yes. Just to clarify that in my presentation, I did mention that the girls are more vulnerable to HIV infections, not the boys. That the girls are 3 times more vulnerable than the boys of the same age grade because of certain reasons. Of course, we know the physiological structure of the females, the social aspect comes in there. If you're hearing of 5 cases of rape, 4 out of that 5 is always on the girl. And then, of course, for economic reasons. So most of these reasons are the ones that make the girls 3 times more vulnerable than the boys. Not that the boys are more vulnerable, it is the girls.
Thank you. Catherine, your hand has been up. We thank you for being at our session, and we'll be glad to hear what you have to say. Catherine, you are muted. Unmute yourself and speak. Okay. Okay, Catherine, you are muted. On that note, until she comes on to say what she has to say, I want to thank everyone who was present at this session, and ask that you keep in touch with us, and we will see you in other sessions. I'll be putting our email address on the chat box so that you can reach us after today by email. But we would like to take a photograph. If you don't mind, you could put on your video so that we take a photograph. So, taking the first, we are going to take it twice. I'm taking the first one after the count of 3. 1, 2, 3. Okay, I'm not the host. Loretta, you better take this photograph. The second page after the count of 3. 1, 2, 3. So Loretta, have you taken that photograph? I'm bringing the first page again so that you are able to, after the count of 3. 1, 2, 3. It's been wonderful having all of you here. We hope to keep in touch. Like Mabel said earlier, we've been attending CSW since 2009, but this is the first virtual CSW. It's been an experience, and nobody knows about the future. So until then, until we're able to go physically again, let's all continue to make the best out of the virtual spaces.
Amen. Thank you very much, Monsi. Have a nice rest. Thank you. Bye-bye.
Bye.
Hope to see you physically.
Thank you all. Thank you.
Bye.
Bye.
Thank you.
Bye, everybody. Thank you for participating.
Wonderful. Tona.
Bye-bye. Bye-bye, Momsi. Bye-bye.
Bye. Obehi, thank you.
Thank you, Momsi. Have a good night.
Thank you so much,
You have
Momsi.
to share your email with Kanem.
Thank you, Momsi. Thank you, Momsi. Thank you, Mom.
This is the seal.
Adiza, thank you. Anderson, thank you.
Thank you, Mom.
Don't go out yet.
Okay, Mom.
Angela Fisher, good to put a face to that name. Thank you.
Mom, CDP, come back. We miss you well.
Thank you. See the baby where they look after.
Baby,
no worry, I will soon come back. But the last ticket I bought just got cancelled post-COVID COVID wahala. Lufthansa, they are no longer flying this route. So now, in short, I have to look for another airline. That's the second ticket. My first ticket, second, third. So I really want to come back. I just hope the airlines are able to fly as they should.
So which airline stopped flying the route?
This one now is Lufthansa that I just had that misfortune. I want to go and try this Addis Ababa, Ethiopia Airlines. Although their flight there is like 36 hours. That's why I was running from it. I went to Lufthansa, which had 16 hours. But now I'm ready to do 36, 40 hours just to be able to come back to Nigeria. That's not funny. Wearing face mask for that length of time.
Yeah.
So I go quick book that one so before I change my mind.
I go Benin City, I stay 5 days, but I know I go GPI, talk, but Monsino. So
no worry. When I come back, I go see everybody. Okay, fellow.
We can't wait to see you, Mom.
Obey, thank you. I did miss you too. I want to thank all of us for this session and encourage us to attend as many other sessions as we can. This is still CSW, though virtual, it's a CSW of a different kind.
Very rich.
So make the best of it so you are able to build your organization stronger.
Madam Grace, thank you for everything. GPI, thank you. This is Catherine. God bless you all. Mabel, thank you. Hope to see you soon again.
Catherine, very sorry over your loss. Catherine lost her brother this week.
Okay.
Thank you for still being in our session despite your bereavement. May God console you.
Thank you. Thank you so much. Have a good evening, all of you, and God bless you.
Thank you. Vera was also able to log in. Vera lost her mother on Sunday or Monday, on Monday. Yeah, she lost her mom on Monday. I saw her briefly in the session. Vera, thank you.
Yeah, these are great people.
Doctors, you don't want to show us your photo?
Is the National Liaison Officer?
Yes. Yes, Vera is a liaison officer in Abuja. Doctor, so you dey road, eh? Thank God the Americans don't they wear face mask. Thank you for joining in. Vera Iyamu, okay, that's true. We have two Veras in the house. Vera Iyamu was also in the house. She actually left work to be able to join us. We appreciate that sacrifice.